Omicron variant is now dominant in Gauteng. It's been detected in all of the province's districts. Last night, Gauteng accounted for 72% of new infections. The test positivity rate in the country's most populous province has jumped to 15.9%. Worrying numbers, considering that only 33% of adults in Gauteng are fully vaccinated. Let's get an update from Dr. Mary Kawonga, Chairperson of the Premier's Advisory Council on COVID-19. Thanks for your time, Doctor. We appreciate it. So as things stand, we look at the numbers in comparison to other provinces. And last night, over 6,000 cases in this province. How concerned are you?
Good evening, Shahan. Thanks very much for having me on the show. I think we're very concerned when we see numbers rising at the rate at which we're seeing them rise in the last couple of weeks. It is something that concerns us. So not only, as you mentioned just now, not only the cases are going up, we've seen an increase in the percentage of tests that provide a positive result, and it's gone above 10%, which is a worrying threshold. And so that gives us an indication that the risk of infection in the community has increased. And when the levels of community transmission increase, it worries us because it means we'll start seeing more and more cases as the weeks go forward. So It is a concern.
Carry on.
Yes. So I was saying it is a concern to us. And so I mean, one of the things we're trying to inform the public about, and we mentioned this at the media briefing earlier today, is that I think there are things we can do, even though we know that it's now the Omicron variant that's dominant in our province. It's still a SARS-CoV-2 variant, and therefore the measures that we've been using previously regarding adherence to mask wearing, avoiding large crowds, avoiding close contact, etc. All of those measures need to be stepped up because that's one of the ways that we are able to control transmission of this virus. And we know that they work, masks work, and there's evidence to support that mask wearing consistently can reduce the incidence of new infections.
You know, as I was introducing you, the latest figures were released, and nationally we have 11,535 new cases. Gauteng, again, accounting for the majority of these new infections at 8,280. And for comparison purposes, I'll tell you what the next province comes in, and that's only 727 in the Western Cape, KwaZulu-Natal 630. So in terms of preparation, Doctor, that's key because the Ministerial Advisory Committee has slammed provinces previously and again for not preparing properly. This time around, will it be different?
Well, I certainly hope so. There's people, I think in the Gauteng province, the department has learned lessons, and they did say that the leadership from the Gauteng Department of Health was also at the media briefing. They did indicate to the public that based on the lessons learned from previous waves, they are already preparing in terms of beds and other capacity is being prepared for the anticipated rise in hospitalizations. I mean, what we've noticed so far from the data is the rise in hospitalizations is a lot slower. It's not increasing at the same rate as cases. Just as an example, in the weekend of 27th November, we had 9,100 plus new cases in that week, which was a 330% increase compared to the week before. And the week prior to that, they had observed over 200% increase in the number of cases compared to the week before. We haven't seen that kind of increase in hospitalizations just yet. And I know there's often a lag between cases resurgence and hospital resurgence. But with that, notwithstanding that, we haven't seen the same level of increase. However, we do anticipate the hospitalizations will start to climb, especially since we're now beginning to see 6,000, 8,000 cases a day in Gauteng. The modeling that's being done for the province indicates that even taking into account some of the features such as potential reinfection due to Omicron variant, the hospitalization wave in the fourth wave will not be as large as the hospitalization wave in the third. The expectation it will be half of what was experienced in the third wave.
Even
And
though,
I think the Department of Health, that they have capacity to cater for those number of hospitals.
how do you come to that determination when we still don't know much about Omicron?
So what I mentioned was just the potential for reinfection. There were a number of different scenarios that were put forward. I mean, when the WHO declared Omicron as a variant of concern, there were two things that they highlighted: the potential for reinfection and the potential for rapid growth. And we've seen the growth issue, and so there were a number of scenarios put forward to say, assuming the rate of increase is by a certain percentage, you always have the best case, middle case, and worst case scenario. We're still awaiting further details about the extent to which reinfection is a problem. But that was one of the factors that was taken into account by Prof. Malado when he did the modeling for Gauteng. And so this revised the hospitalization, the hospitalization numbers, the predicted hospitalization numbers upwards compared to the previous modeling that had been done. But the expectation is there will not have the same level of hospitalizations as we had at the peak of the third wave so far, all things being equal. A lot of work still needs to be done, and obviously the numbers will continue to be tracked, and anytime there's a deviation, the modelers are able to quickly tweak the model to give us a better indication.
Will you be taking extra precaution when it comes to pediatric wards? Because we spoke to Dr. Matiba from Chris Hani Baragwanath, and she said that her concern is that we're not prepared for pediatric wards because they are currently seeing more children being infected this time around that need to be hospitalized. But obviously we have to put the context there that it's not of serious concern just yet nationally.
Indeed. Look, the issue about pediatric hospitalizations was also raised by the NICD when they did their media briefing on Monday. And that information was passed on to the relevant authorities in the Department of Health who are responsible for providing hospital care. So my understanding is they're looking into that and will be working to ensure that they're prepared. And they're also monitoring the childhood hospitalizations in all the other hospitals. But I'm sure they're working on it. Yeah.
Okay, let's talk about unvaccinated people in Gauteng. It is worrying, isn't it, that we have about 8 million people who could be vaccinated that actually haven't come forward. And with regards to the hospitalizations that you're seeing right now, do you know and can you tell us whether or not those who have been admitted are unvaccinated or not?
I mean, that's a very important question because I think understanding that will give us a sense of, whether the vaccines are really working to protect people against hospitalizations. At this point in time, we're gathering the data that will allow us to have a conclusive answer to that particular question. When patients are hospitalized, there is provision to indicate a vaccination status. And so that data is being gathered as we speak to try and come up with an analysis that will give us an indication. However, there have been some early indications from the data from Gauteng, and this again was presented in the media briefing on Monday by the NICD. And what they looked at was out of the hospitalizations in the last 4 weeks in Gauteng, 25% of them had data on vaccination status. And of those patients who had data on vaccination status, 95% of them were unvaccinated. So, I mean, so again, there's a proviso there that it's only those who had the data on vaccination status. But what they did show was the majority of them were unvaccinated. And obviously, we just want to get a little more data on patch up all the data gaps so that we can have a more definitive answer. But I think what it's telling us, early indications are that probably, a significant proportion of people who are being hospitalized are unvaccinated.
Yeah.
The other thing that we've noticed is the proportion of admissions amongst people between the age of 20 and 39 in the last 4 weeks in Gauteng hospitals has increased relative to the older people over the age of 50. So all along, since the first wave, the significant proportion, over 57% of admissions in our hospitals were people over the age of 50. But in the last 4 weeks, we've seen a shift where the younger age group between 20 and 39. So that's giving us, it's a hint. We're just wondering whether one of the reasons might be because there's a higher vaccination rate amongst older people, lower vaccination rate amongst younger people, and therefore we're beginning to see them contributing a higher proportion of admissions in both public and private hospitals.
We certainly could learn from our adults, the elderly people in this country when it comes to vaccinating, isn't it? So let's talk about your vaccination drive, because it has to be made really simple and easy, accessible as well to people in this province, it seems. What are you going to do differently to try and encourage people to get vaccinated?
Well, you must understand, I chair the advisory committee, so...
What's your advice?
So what we've been advising, I think the people we've been advising can tell you better about what we've been saying, but I think one of the issues that has been raised is, I think it's important to have different models of reaching people, and the Department of Health is working on different models of reaching people. Some of the vaccination sites are at health facilities, some are at workplaces, and they're now beginning to have drives at schools in conjunction with the Department of Education, etc. So I think we just have to work, out the box and try and find mechanisms of reaching people that work with the context that we're working with, which is, Gauteng is made up of various communities with different needs. And it's about understanding the different populations' needs and meeting them where they're at. And I think a vaccination program has evolved from the beginning, where it was mostly at specified sites, and it's now becoming more involving outreach, workplaces, school-based, etc., etc. And I think the other issue is also that messaging is important, and that needs to continue. But there's also need for working with community structures, and there's a group in the Department of Health called the Social Mobilization Team that has been working with various sectors, industry, labor, all sorts of different sectors, to try and understand the needs of different populations in terms of where they would want to, receive their vaccinations. And so those are the kinds of things that they're doing, trying to diversify the program from just having a standalone vaccination site at a health facility, for example.
All right. Thank you so much for your time. Good luck with that project. Dr. Mary Kawonga, Chairperson of the Premier's Advisory Council on COVID-19 in Gauteng.